Mr. Speaker, my question is for the Minister of Health and Long-Term Care. In 2014, an estimated 73,800 Ontarians were diagnosed with cancer, and 28,000 of those people died from the disease. This means that 8 people are being diagnosed and 3 people are dying from this disease every hour of the day. I'm happy to say that I'm a 15-year survivor. I hear from my constituents. I hear from my constituents in Barrie that are affected by cancer, either themselves or their families. My heart goes out to all of those affected by the disease. Every day we are one step closer to finding a cure. The Canadian Cancer Society is a national community-based organization of volunteers whose mission is the eradication of cancer and the enhancement of the quality of life. Minister, I ask, what are we doing to raise awareness of the Canadian Cancer Society?
Thank you. Minister of Health and Long-Term Care.
Thank you, Mr. Speaker, and thank you to the member from Barrie as well for asking this very important question. We're in Daffodil Month, Mr. Speaker. It's held every April, and it's the national fundraising campaign of the Canadian Cancer Society. And donations that are made during this month, the month of Daffodil Month, help cancer patients and their families and communities right across Ontario by funding life-saving research, support services, and other important work so that fewer Canadians hopefully will be touched by cancer, Mr. Speaker. And thanks to Ontarians' generous support of Daffodil Month and the Canadian Cancer Society's other fundraising programs, the charity was actually able to fund more than $20 million in world-class research to fight all cancers in last year. And during this time, the Society also provided critical support to more than 49,000 Ontarians. So, Mr. Speaker, let's all do our part to support this important month, and I thank the Canadian Cancer Society for their dedication to the cause.
Thank you. Supplementary.
Speaker, Ontario is a leader in cancer care in Canada and around the world. I have heard positive feedback from the constituency in my riding about the cancer care system in Ontario, and I thank our government for the wonderful cancer care centre that we have built in Barrie. In fact, in Ontario, an Ontarian who gets cancer has one of the best chances of survival anywhere in the world. But we know that too many Ontarians are diagnosed with cancer each year, which is why we continue to take action to fight this deadly disease. Minister, could you please tell us, I ask, what is our government doing to ensure our cancer screening process is robust?
Question. Thank you. Minister.
Thank you again for the question, Mr. Speaker. Cancer screening is easy, and it definitely saves lives. It's imperative that Ontarians get screened for cancer, and we've worked hard as a government to expand screening services and its availability across this province. We broadened the scope of the Ontario Breast Screening Program back in 2011, so high-risk women are screened earlier, starting at 30 years of age. And this means 90,000 more screens over a 3-year period. In 2013-2014, the Ontario Breast Screening Program provided over 500,000 breast screens for average and high-risk women across the province. And there are currently over 150 of these sites, of these Ontario Breast Screening Program sites across the province. We also launched Canada's first province-wide colorectal cancer screening program to combat the second deadliest form of cancer in the country. And in 2009, we further expanded cancer detection by funding the PSA test to help fight the most common cancer among Canadian men. There's always more work to be done.